Nice.
Yeah.
Well, no, it's so rare. So I'll give you an example. So a choristoma is basically normal tissue in an ectopic location. So and we had a case when I was a resident that looked like a funny film, an atypical schwannoma on MRI. It just didn't look right. It looked very heterogeneous. It didn't have this sort of expansile, smooth rind to it. And when we opened up the CP angle, it was benign salivary gland tissue. So it was almost like a salivary gland had migrated, portions of had migrated to the CP angle. So that's an example of a choristoma. So don't see them very often, but that's it's definitely it happens enough to where it's an entity of its own. So that's very low in the differential, but it's something if somebody were to ask you that, that's something you'd want to throw at them. Yeah. So Lily, I'm sorry, I'll have to leave in about 7 or 8 minutes, but we're definitely gonna pick this up next time. So tell me what you think this is. Why would you say this could be? Can you tell me the difference between what you would expect to see if this is a schwannoma versus a meningioma and why? Just on radiograph.
Okay. So on radiographic appearance, there's usually what you can see here is a typical ice cream cone kind of appearance, whereas in a meningioma, you see a broad-based or a dural tail. So along the edges where you find the bone, you would find that instead of it going into the meatus, if it was a meningioma, it would be tapering out along the posterior fossa brain. That is along the dura of the posterior fossa. The other thing is that meningiomas often have calcifications within them. So the typical appearance with like kind of salt and pepper-ish or presence of calcifications within the lesion would sell out to be a meningioma vis-a-vis a vestibular schwannoma. Another thing is the smooth, okay, both can be smooth, but schwannomas are typically smooth. They have a smooth appearance. Yeah. And some of them have cystic components, which will usually be a hypodense area within the smooth area that is taking up uniform, that has taken up contrast uniformly.
Yeah, you mentioned something that's really important. What you mentioned something about it. What if you could only have a CT scan on this patient and if it's smaller, what kinds of things are you looking for to differentiate the two? You kind of mentioned some of it.
So if you're looking at a CT scan, again, want to look at the location. Schwannomas are usually found within the nerves, or they are found where within the nerves, whereas the meningioma is found along the edges of the dura or along the
But in CT, you may not be able to see that as well, but there's a couple things you might see. You can sometimes see the fluid displaced in the cistern on a CT scan, which tells you the size. But you mentioned it on CT, you can see calcification, right? Kind of bone density. So sometimes I had a board exam on that exact thing where they said, oh, you can't get a CT, or you can't get an MRI if you get a CT. So I got a CT and I saw these calcifications in the CP angle. And I said, well, this looks like possible meningioma. I'm concerned. And they said, oh, we made a mistake. Yeah, you actually can get an MRI. But that was the hope, is they were hoping you would see that. So you could really look closely at that CT scan to make sure that, you can gather some information from that. Okay. So what other findings are concerning here on this MRI? Is there anything else that you see that is of concern that may help explain some of the patient's symptoms? Think about what they presented with.
So this patient, in this CT scan, you can see that they probably
MRI. This is an MRI.
Sorry, in this MRI, you see that the lesion is extending and pushing into the cerebellum. So there's a possibility that they have obstructive hydrocephalus. which could give the patient worse symptoms because of the blockage of the lateral cistern. It could be blocked given the size of the tumor. Also, the instability could be caused by compression of the cerebellum. Yeah.
Do you see any evidence of hydrocephalus here?
And sorry, evidence of hydrocephalus. I know.
Yeah, hard to see you can't see the lateral ventricles, but do you see something toward the brainstem?
At the brainstem.
What's the the lateral ventricle? What's equivalent of the lateral ventricles down closer to the CP angle in the brainstem?
Repeat the question again. What is the equivalent of?
Is there a ventricular system adjacent to where this tumor is?
Yes.
What's it
The
called?
lateral cistern.
No. Brad, you looks like about ready to say something.
No, I'm just I'm trying to give a little subtle hint here.
He's sending you messages.
No.
Have you heard of the fourth
Can you
ventricle?
see that, Lily?
Fourth ventricle?
Fourth ventricle. Yes, yes.
Yeah. So it's a little bit dilated above probably where the tumor is. So you're seeing maybe a little hint of a shadow there that could indicate that there may be some upstream blockage there, right? So you want to look closely at those big brainstem compressing tumors that they typically will pinch off the fourth ventricle. And then that's when you're going to get a lot of this extra, non-communicating hydrocephalus, meaning it's not communicating with the rest of the spaces. And it's going to, so that's a big issue, right? So that's something you have to think about. Now, we also mentioned another thing that he complained of in the clinic when you first saw him. Think about his cranial nerves and what was he complaining of, and does that make sense with this film?
So when he presented, he was
What did
complaining of numbness.
What did he say about his face?
Numbness on his face.
Where's that coming from?
And hypoesthesia. It probably coming from compression of the trigeminal. The trigeminal nerve.
And where does the trigeminal nerve exit the brain? At what level?
At the brainstem level at the Merkel's cave.
Okay, that's up higher. That's where the ganglion is, where it splits off into the three main subdivisions, right?
Yeah.
Where does it exit the brain exactly? Where does the nerve exit the brain or enter the brain, however you look at it? What's the root entry zone of the trigeminal nerve into the brain?
It's usually at the pontomedullary junction.
Yeah, it's kind of at the pons, really, right? Yeah. So does this, I know you don't have a coronal here, but does that make sense here? Does that tumor this size, does that possibly explain why he's got some hypoesthesia on that division?
Yes, it does.
Right. Yeah, right. Because it's encroaching the pons area there, right? So if you look at a coronal, we don't know exactly and this is one slice of an axial. We don't know how high it's going, right? So he's got several things going on here to explain his situation, right? The hearing loss, the balance issues, and the facial numbness, right?
Yeah.
Yeah. So I have to go, unfortunately, but we're gonna pick this up next time, and we still have like 2.5 cases to go. Yeah, we'll pick it up next week. Well, actually, so Brad, next week,